Ako pislit mo.
Pislit yun.
Okay, sir. Breath through your mouth, sir. Breath through your mouth. Okay, breath through your mouth, sir. Okay. Dapat daghan din siya lubricant pa para di sakit. Sakit pa ba ni? Kanang naman irritation. Dapat ang uban class, I have seen in the YouTube na ang uban, when they're going to insert the catheter, aside from putting lubricant sa kamot, ila pang ginabubuan ng lubricant sa sulod.
Ito kanila mo.
I saw it, oh. Ila pang ginabubuan nga para civic dito, no?
Giraon ko na ano.
Okay,
What daw? Bilok. Isa may nakakitar na ikaw.
Giraon ang penis.
Wala naman.
Kaya na ang may lubricant.
Sa mail mo ba?
Ikatintay po ako.
Sa mail, taas na ba?
Naka-anesthesia ka, spinal, so you cannot feel anything. So, according to those who are awake, when they were catheterized, bilok daw.
Bilok.
Na, kanang pagsulod, sakit kung dili kuno ka ay well lubricated. Dapat daghan bilok agad para di sakit. Okay? 6 to 8 inches is already there. Then there is a urine that passed through this tube going to the urobag. So we're going to put first the urobag here. It might filled up. And then now you're going to introduce the 5 cc or 10 cc syringe or sterile water. Then you're going to lock the sheets to the hub. Okay, and place the balloons. Okay, done. Now you're going to slightly pull the catheter if the balloon has really inflated inside. Okay, pull gently. Okay, there's already a resistance. So if you feel any resistance, ayaw na pagdiraha, that's very painful. So you might be wondering, asa dapit ang balon? The balon is floating inside the urinary bladder. Really sa urethral canal is inside the urinary bladder. So the urinary bladder is located in the hypogastric area. Nag-float na siya sa hypogastrium, not in the urethral canal. So this is the orifice, urethral orifice, or urethral meatus, or urethral cavity, or opening. And then inside there is the canal, urethral canal. And then after the canal is the urinary bladder where the catheter is inserted and the balloon there is floating. Then after pulling, there's already a resistance. We put it back to avoid obstruction of the balloon in the opening of the urethra. Okay. You're done. Now I'm going to remove my gloves. Good gloves. Then, anchor. Anchor the catheter at the inner aspect of the thigh, inner. So put a leeway in order to avoid accidental pulling of the catheter. Then the base of the cluster should be taped on the upper portion. Then you entwine it. Entwine it in the tube. So ang idea ng plaster cloth is adhesive. This is not very adhesive. This is only for demo purposes, this kind of plaster. Okay, they are intertwined to each other. And then you put additional plaster to reinforce the tube that you have anchored. Okay, so plaster to reinforce. Okay, you're done. Catheterization. Of course, documentation, you put the date, the time you inserted the catheter. Of course, you affix the name inserted. If you have an assistant, you include the name also. And then, of course, the vital signs, baseline vital signs, and the vital signs right after doing the procedures. Then you check the volume of the urine, the color, check for any presence of blood, presence of sediments, or any discoloration, okay, or the cloudy thing that might be floating inside this bag. And then class refrain from raising the urobag higher than the patient because the urine might flow back, which will cause urinary infection, then it should be always hung down. No? It should be down. And then it should be hung at the bedside of the patient or at the side of the patient. Okay, question? None? Okay, put patient comfortably. Okay. So we're now going to proceed with catheter here. The patient has been catheterized yesterday and now we're going to clean the catheter. So cleaning of the catheter will be done every day class ha. Then every after perineal care, of course, you paint the insertion of the catheter to avoid infection. So I have here cotton balls and then I am going to what? Pour with betadine. Using again sterile gloves ha. I have changed with a new set of sterile gloves class. In your video, dapat kumpleto talagang gamit nyo ha. Ito, nag-demo lang ako. Pero sa inyong USB, dapat naka-gloves kit mo. Okay? Agree? Then, you're going to hold the insertion site and then in a rotatory motion, you clean the catheter at least 2/3 high. Then discard. Then, get another cotton ball with betadine. In the same motion, single stroke. When you say single stroke, pag abot mo sa silong, ayaw na ipagtaas na putin mo cotton balls. Isa lagi na siya kaagi, okay? Then after the third cleaning, you squeeze the cotton balls. You don't squeeze the penis ha. You squeeze the cotton balls in the insertion site, not the penis that you're going to squeeze. Basta inyong kustiton. Nakita ang pasyente, basta yung kustiton. So only the cotton ball that is holding the tip of the catheter for the betadine to enter the urethra. And done. Okay. Question? None.
Ano?
Yeah.
Okay na.
Okay na? Okay. After 5 days, the physician decided that the catheter should be removed. So, ordered the doctor, date, time, then the physicians ordered the catheter to be removed. Remove catheter ASAP. No, ASAP. Okay, so again, bring along with you the syringe, empty syringe, sterile, this is sterile, without a needle, and then the waste receptacle. Where's the waste receptacle now? Nilipad na, ay. Okay, put this in between the patient's legs. And then you're using only clean gloves. Then remove the sterile water here. Of course, you explain the procedure to the patient. Lock and then aspirate. You lock it very well in order to be able to aspirate the fluid. No? Because if you will not lock this one class, you will have difficulty in aspirating the sterile water that you have to introduce because there is an air. Okay, I did not pull the plunger, but it just pulls by itself now because of the air pressure. Can you see it?
Yes, ma'am. Meron lang siya here.
Oh, the air pushes the water that is being introduced inside. Okay, so then remove. Next,
Luwa.
and then we have here cotton balls with water. We remove. And then, sir, kindly breath through your mouth when I pull the catheter. Okay, breath through your mouth, sir. Breath through your mouth. Breath through your mouth. Okay, then you put it directly on the waste receptacle. And then, of course, before putting the bag in the waste receptacle, you're going to check the volume, the sediments, the presence of blood, the quantity or the volume of the urine, and then you put inside, including your gloves. Okay? Then discard in the proper waste receptacle. Then, of course, you have to tie this one before disposing class. Tie very well. Question? Of course, after removal, you have to instruct the patient to urinate within 6 to 8 hours. Otherwise, the catheter will be reinserted. And we have mentioned already the ways of stimulating the patient to